Hi everyone, welcome to my channel. My name is Chichi and I'm the sole owner of Chai the EDNP, and that's the name of this channel. Purpose of this channel is to create a mutual learning environment where I can learn from you and you can learn from me, and also to inspire the next generation of nurses, the next generation of providers, and people in general just to be the best version of themselves in whatever career that they choose, but focusing in healthcare. I should talk about my journey, right? Through nursing, and how did I get here? So I've been a nurse. I was a nurse for 7 years before I became a provider just last year, 2018. I began my career at a cardiac observation unit at a community hospital, and then I moved to a kidney, liver, pancreas transplant unit, which was also a telemetry unit and also overflow. I floated around the hospital a little bit, so through other tele units and med-surg units. Then I came to the ED, emergency department. So I've been in the emergency department for 5 years, up until I became a provider. So during my journey through nursing, I've experienced different things. I also have charge nurse experience. So I've been charge nurse at the liver kidney transplant unit, at different units in the hospital, in the same hospital. I was also charge nurse back at the cardiac observation unit. Also, during my 5 years in the ER at a university hospital, an academic center, I also was working at another academic center where I worked on a short stay unit, so pre-procedure, post-procedure recovery type of deal, and also floated to their emergency department. I've also been charge nurse, so in the ER, I've been charge nurse in the ER. I've also worked the triage area. I have also done a little bit of trauma. I've also done radio ER nursing. So I have a variety of experiences, of nursing experiences, and the few specialties that I haven't really been to is the operating room and intensive care unit. Now, I also am clinical faculty at a major academic center, and I have been a clinical faculty for the last year and a half, almost 2 years now. I teach both in class and at clinicals, so I'm very passionate about that, and I'm definitely passionate about imparting knowledge to the next generation of nurses. So that's my background, and that's my story. Another facet of my story that I wanted to point out was my NCLEX journey, right? So I finished my bachelor's degree back in 2011. I took my NCLEX, which I failed the first time, and then I took it the next time and I passed it. So I wanted to point that out because a lot of people struggle with the NCLEX, right? It's like this big looming obstacle that people can't get over because they can't pass the exam, and people think that that should stop your journey. You know, once you fail the NCLEX, your journey stops because you get locked into this depression and you think it's never gonna end and you think you're never gonna pass. But I'm here to be a testimony and to tell you guys, I'm a testament to the fact that there is life after the NCLEX. You will pass the NCLEX, you will succeed, you will fulfill your dreams, and things will get better, and you will be exactly where you want to be and where you need to be. So I just wanted to get on my soapbox about that and to let you guys know that that's possible. So with that being said, I welcome all feedback. Basically, the structure of this channel will be odd episodes, essentially have case studies that of patients that I've seen during my practice as an emergency department nurse practitioner, and you'll also see some case studies of patients that I have seen or things that I have seen as a nurse, especially in the ER. You might hear some about when I was on the floor, but especially in the ER. And then the even episodes will basically have talk about all things nursing. So some of the episodes will talk about how to survive nursing school, just different topics in nursing that we can dialogue about. I can learn from you all. You can learn from me. We can help each other, right? Inspire each other and help each other get better in all aspects of life, essentially. So I'm so excited for this journey, because I think even this channel is a journey. This has been a baby in my, should I call it womb, in my mental womb. I've been needing to put this out there. I've been needing to start something like this. And for the future, I wanted to let you guys know, just to have something to look forward to. At 500 subscribers, once I reach 500 subscribers, I will be doing live episodes once a month. So the live episodes will be one case study that we can talk about live, and then that will be on a odd month, yes, and then on an even month will be anything nursing. So I will be fielding questions from people that are on the live feed. I'll answer anything. I'll talk about anything. So I'm so excited. I'm just stoked about this, if you can tell. And yeah, I look forward to having any comments, any feedback. For any questions or business inquiries, please email Chai the EDNP. There will hopefully soon be a social media page of some form, which will be put down on my channel page. So please click the link to subscribe. And thank you so much for watching. Bye.